How else are we innovating? We bought a company called CareMore that Linda described in the introduction. So CareMore services Medicare Advantage members, those seniors who have special needs often. And we think it's going to be a huge differentiator over time because 28% of Medicare spending is in the final year of life, and 78% of that is in the last month. So we bought this company called CareMore, and it's really a pretty simple thing. There was an article about it in the Atlantic magazine this week. But they have a young 65-year-old, let's call him Joe. He joins CareMore, and he goes to their neighborhood care center, and he gets a physical. And the physical he gets, he might get a referral to their Nifty after 50. See, you only say the word nifty if you are older than 50, apparently. So Nifty after 50 is their gym. So when you walk into a Nifty after 50, there's a gym on one side and there's physical therapy on the other. And the gym, they don't have any dead weights to lift. They have pneumatic tubes and all the machines so that there's not the jerking motion for seniors. They have some physical therapy and exercise classes. One's called Cane Fu, in case you have a cane and you might need some work. So healthy seniors can come into a CareMore neighborhood center and get all those benefits. Now, what they also do is, let's take somebody older, an 85-year-old person who's at home who has congestive heart failure. Every day, she's asked to get on her scale, and her scale remotely transmits that information to the care center where the nurse is. And the nurse reads, oh my goodness, this person's gained 3 pounds. And that's a real indication of risk for somebody with congestive heart failure. So the nurse calls the patient and says, I see you gained weight, can you come to the care center? And the member says, I can't, my family's out of town, what am I to do? And they said, don't worry, we'll send a car for you. And they send the car, they get the member, they bring her into the care center, they help and make sure her medication is right. And what they've done is avoided 3 weeks in the hospital.